Good Morning Washington's Women's Health Month Spotlight is sponsored by Fairfax Radiology Centers.
Well, today we are at Fairfax Radiology talking spring screenings for women's health, talking specifically about mammograms and bone density scans. So ladies, listen up. We are with Dr. Elise Berman. Always so good to see you. So let's start with the mammogram and why that's so important.
So mammograms are really, really important because it's the best way for us to find breast cancer early. And we really need to find breast cancer early because the earlier we find it, the better the outcomes are.
All right, so at what age do we start the mammogram, and then how often do we need to follow up?
So your yearly screening mammogram should start at the age of 40. Now, some people, because of family history or other medical conditions, might need to start earlier, and that's a discussion to have with your healthcare provider.
Okay, wonderful. I know we have a lot of women who have that dense breast tissue and that are sometimes a little concerned that the mammogram is not going to pick up everything. What other options do you have for those women?
Absolutely. So we use digital breast tomosynthesis. It's also called 3D mammography, and that helps us find some of those really subtle and early signs of breast cancer. And then there's some additional supplemental tests or complementary tests to the mammogram. So there's ultrasound, which uses sound waves to create a different sort of picture of the breast. And there's a screening or an abbreviated breast MRI, which uses an MRI machine and contrast to provide highly sensitive images of the breast looking for breast cancer.
Wow, so here at Fairfax Radiology, you really have the best technology to be able to really get that early detection, which is what every woman wants. Let's start moving into the bone density scans. I'm not really familiar with that. What exactly is a bone density scan and why is that so important?
So a bone density scan, also called a DEXA scan, is a test to look at the density or the health of a person's bones. So it takes a picture of the spine and the hip and sometimes the forearm, and it tells us what the risk of developing a fracture is. And that's really important information for your doctor to know.
Okay, and at what age do you start getting a bone density scan?
So women will start at the age of 65 and they'll have a bone density scan every 2 years, unless they have some other medical condition or other concern, in which case they might need to start sooner or do it more frequently.
You know, Dr. Berman, you made a great point earlier that the month of May, a really great time to remind your loved ones to get these screenings.
Absolutely. I think that it's a really important time to take the opportunity for those women in your life that you love, that you're close with. Remind them that if they're due or overdue for their mammogram, they should get their mammogram. You might save someone's life.
And again, Fairfax Radiology, you can see all of the information on your screen of how you can connect with them. And it's just some really great stuff. So Dr. Elise Berman, thank you so much for educating us and helping us prevent all of these health things.
Lovely
Thank you.
to see you.